Hey guys, what's up? Coming at you today outside because I am home and all my roommates are home and I can't talk to myself in my room because I'm embarrassed. So audio might be a little bit bad, so please forgive me for that. Today is Sunday. Got my coffee t-shirt. Oh, it is definitely a second cup of coffee kind of day, girl, you know? Yeah. So today I wanted to share a super quick video with you guys. I had a complete aha moment a couple of weeks ago. So I started to develop a little bit of pain at the A1 pulley. I could tell it was inflamed, so definitely starting to get a little bit of tenosynovitis there. And what I did for myself was, in addition to things like ice massage and kind of intrinsic stretching, trying to like stretch everything out and try to not use my hands so much for gripping, I actually used two little trigger finger splints that we sometimes use for patients too, and whoa, super windy. It worked like a charm. So I had this total aha moment. I don't know why I hadn't been using them more with my patients, but I'm sold 100% on them. So I'm going to show you guys what I used. Okay, so the first splint that I used, which I actually have been using with patients forever, it's not really even a splint. I use this little soft Velcro material to make a little tube. And so this one is just made with like a dual strap Velcro, but you could use anything. It's really soft, so that's why I like it a lot, because I use it for people when they're sleeping, and so it's really comfortable. It's not digging into them, it's not cutting into them, they're not going to get pressure marks or anything like that, which is really nice. And then it's just fastened together with some iron-on seam tape, which is what we use a lot at our clinic. So I just literally use scrap material, okay? Like I cut like a teeny piece of Velcro, a little bit of seam tape, and then iron it on. And you want to make sure you measure the person's finger. The key is to be able to slip it on and pull it off without any resistance, but it shouldn't be so loose that it's falling off of them during the nighttime too. So it works really well. I've been sleeping with it a little bit the last couple weeks since my finger's been bugging me, and it's been great. That way I don't have, you know, that curled fist with the lumbricals getting into that carpal tunnel area, and just kind of that gripping sensation, so that in the morning it's really tight and stiff. So that's what it looks like. It's just a little tube. I think you can get creative with this. You don't necessarily have to use the same materials that I did, but just like a great alternative little nighttime soft sleeve. It's not even a splint. You could even probably just use duct tape, I think, to be honest. Like make a little tube out of duct tape if you're handy. Yeah, play with it. So that's the one that I use at nighttime, and that's what I've been doing with patients forever. A lot of people really like it, and it lasts a really long time too. So super cheap, doesn't cost any extra to make. And then the second splint that I actually made for myself at my clinic, with just scrap material, is this little ring splint, which is, it's just basic. I mean, I think most people kind of have seen these little trigger finger splints. It's just a ring that slips onto the finger with this little blocking component, and so as you can see, it just kind of slides onto my finger and it blocks me, so I'm able to bend the PIP and the DIP joint, but my metacarpal joint is limited in flexion, and that way I can still use my hand and it can still be functional, but I'm not doing the full-on grip. So let me tell you, this thing is pretty annoying. Washing dishes really sucks with it on. It digs into you a little bit, it cuts into you, but it definitely makes you rest your hand, and it definitely doesn't let you use your index finger, or whatever finger is bugging you. So honestly, like when I was using this, and I wasn't even using it, you know, the full day, like I actually didn't work with it because obviously I'm a therapist, and I didn't do any of my manual treatments with it on. I didn't work with patients with it on, but in between patients I would slip it on, so I would be typing on my computer, mousing, all that kind of stuff with it on, and then again at home, anything I was doing at home I would have it on. Writing is really annoying. Washing dishes, those were the main things that I think I kept it on for. But it really helped a lot. It helped me rest my finger and not keep gripping and using it in a way that was going to make my tenosynovitis get worse. So yeah, so that's basically what it looks like. you can see really easy fabrication, just a little, like a teardrop shape, and then kind of the outer pieces that just wrap around into a ring. So yeah, pretty easy. So the nice thing about both of these splints is that they're really not even splints. I don't even know if I would call them that. They're just made with scrap material, so they're really cost effective. And for me, the aha moment was that they actually really do work. So that was really cool, because I've never, you know, had much feedback with them, because I haven't been using these that much in my practice, but I'm definitely going to now. If people come to me with like a trigger finger, or even just like kind of the start of that synovitis there, that tenosynovitis in the A1 pulley area, like I would make this for them. I think it would really help for people who are having like kind of occasional triggering or locking, but probably not for people who every time are locking. I don't think it's going to be super effective for them, other than just kind of pain management and preventing it from being painful when it locks. But yeah, that was basically my big epiphany moment of like, oh yeah, the protocol of wearing this for 5 to 6 weeks is probably a pretty great protocol. Should definitely follow that. So yeah, it's pretty cool. Let me know if you guys have any questions about this video. Again, super short and sweet. Just wanted to share with you like some personal experience with these two little kind of conservative management techniques for trigger finger, for tenosynovitis of the fingers. I hope you guys enjoyed this video. Hopefully the sound quality is not too bad, and the lighting is not too crazy, and the wind didn't drive you crazy. I apologize, this is like probably a terrible quality video, but just super short and sweet, and hope you guys have a great rest of your day and enjoy the week ahead. Thanks for watching.